थोड़े इम्पोर्टेंट हैं, जो पहले भी आ चुके हैं और आने के चांसेस हैं। तो इम्पोर्टेंट एक्सपेक्टेड क्वेश्चंस हैं, इससे आपके टॉपिक भी क्लियर होंगे और आपको पता भी चलेगा कि किस तरह के क्वेश्चन आते हैं। तो भागना नहीं है, करना है मेरे साथ। चलिए 50 क्वेश्चन के करीब करते हैं, आराम से करेंगे टाइम लेकर, कोई दिक्कत नहीं। अगर आपको आंसर आता है तो कमेंट कर दीजिए फटाफट से, नहीं आता है तो कोई दिक्कत नहीं, कोई और करेगा, आप देख लीजिए, हम साथ ही साथ आंसर भी बताते रहेंगे आपको। चलिए आगे बढ़ते हैं। ऑल ऑफ द फॉलोइंग आर सुपीरियर मीडियास्टिनल ट्यूमर्स एक्सेप्ट। ऑल ऑफ द फॉलोइंग आर सुपीरियर mediastinal tumors except option A parathyroid, option B thymus, option C lymphoma, option D thyroid। जल्दी से क्या लगता है आपको आंसर? फटाफट से कमेंट कर दीजिए फटाफट। So the right answer is option B thymus।
गाड़ी तो हमने बहुत।
चलिए नेक्स्ट क्वेश्चन में बढ़ते हैं आगे। A female patient presented with a 4 × 3 centimeter lump over the right breast. On examination, pure orange appearance can be noted. What is the tumor staging in this patient? A female patient presented with a 4 × 3 centimeter lump over the right breast. On examination, pure orange appearance can be noted. What is the tumor staging in this patient? Option A T2, option B T4A, option C T3, option D T4B। A female patient। तो क्या लगता है आपको आंसर? So the right answer is option D T4B। थोड़ा एक्सप्लेनेशन देखते हैं। Skin involvement over the breast, pure orange appearance classified this as stage T4B. Pure orange appearance is due to the blockage of subcuticular lymphatics. The resultant edema depends the mouth of the sweat glands and hair follicles, giving rise to the typical orange peel appearance। चलिए नेक्स्ट क्वेश्चन में बढ़ते हैं आगे। A 70-year-old male patient presents with halitosis, dysphagia, and regurgitation of food. Which of the following is the most likely diagnosis? Option A esophageal carcinoma, option B eclasia cardia, option C pulsant pseudo-diverticulum, ऑप्शन डी GERD। जल्दी से कमेंट करिए आंसर अब आपको पता है तो। So the right answer is option C pulsant pseudo-diverticulum। थोड़ा एक्सप्लेनेशन देखते हैं। The clinical history of halitosis and regurgitation in an elderly male suggests a diagnosis of Zenker's diverticulum or pulsant pseudo-diverticulum। Basically, the Zenker's diverticulum or cricopharyngeal eclasia or pharyngeal pouch is the pulsant pseudo-diverticulum। चलिए नेक्स्ट क्वेश्चन पर आगे बढ़ते हैं। Which gas is commonly used in pneumoperitoneum, which involves inflating the abdominal cavity during laparoscopic surgery? Which gas is commonly used in pneumoperitoneum, which involves inflating the abdominal cavity during laparoscopic surgery? Option A, oxygen. Option B, nitrous oxygen. Option C, nitrogen. Option D, carbon dioxide. जल्दी से कमेंट करिए फटाफट. Which gas is commonly used in pneumoperitoneum, which involves inflating the abdominal cavity during laparoscopic surgery? Option A, oxygen. Option B, nitrous oxygen. Option D, carbon dioxide. Option C, nitrogen. So the right answer is option D, carbon dioxide. Basically, the carbon dioxide gas used in pneumoperitoneum. चलिए नेक्स्ट क्वेश्चन में बढ़ते हैं आगे फटाफट. What nutrient deficiency is commonly associated with delayed wound healing following minor surgery? What nutrient deficiency is commonly associated with delayed wound healing following minor surgery? Option A, zinc. Option B, magnesium. Option C, niacin. Option D, विटामिन सी. तो क्या लगता है आपको आंसर? जल्दी से कमेंट करिए फटाफट अगर आंसर पता है तो आपको. So the right answer is vitamin C. Basically, the delayed wound healing after minor surgery can be attributed to a deficiency of vitamin C. चलिए नेक्स्ट क्वेश्चन में बढ़ते हैं फटाफट. A male patient was brought to the emergency room after a road traffic accident. On examination, left-sided hydronephrosis was noted. Thoracostomy was done and around 1,800 ml was drained in 1 hour. What is the most appropriate management for this patient? Option A, administer a hemostatic agent through the chest tube. Option B, continue resuscitation for the next 6 hours. Option C, urgent thoracentesis. Option D, emergency thoracotomy. क्वेश्चन एक बार दोबारा सुन लीजिए. A male patient was brought to the emergency room after a road traffic accident. On examination, left-sided hydronephrosis was noted. Thoracostomy was done and around 1,800 ml was drained in 1 hour. What is the most appropriate management of this patient? Option A, administer a hemostatic agent through the chest tube. Option B, continue resuscitation for the next 6 hours. Option C, urgent thoracentesis. Option D, emergency thoracotomy. So the right answer is option D, emergency thoracotomy. Significant blood loss 1,800 ml and the patient critical condition, the most appropriate management is emergency thoracotomy. चलिए नेक्स्ट क्वेश्चन में आगे बढ़ते हैं. A male patient was brought to the emergency room after a road traffic accident in an unconscious state. He has a head injury. On examination, he has bradycardia and hypertension. Glasgow Coma score was 6. What is the next appropriate step in management? Option A, urgent CT head. Option B, thrombolysis. Option C, intubate and provide ventilation. Option D, administer IV fluids. क्या लगता है आपको आंसर? So the right answer is intubate and provide ventilation. Option C is the correct answer. The patient clinical presentation of level of consciousness, bradycardia, and high blood pressure after a head injury. The next appropriate step is to intubate and provide ventilation to ensure adequate oxygen and ventilation while managing potential increased intracranial pressure. Next question. An elderly male patient presents with persistent fatigue and anemia. Given his clinical profile, what is the recommended screening protocol for colon cancer in the patient? An elderly male patient presents with persistent fatigue and anemia. Given his clinical profile, what is the recommended screening protocol for colon cancer in this patient? Option A, flexible signi- Option A, flexible sigmoidoscopy every year. Option B, colonoscopy every 10 years. Option C, fecal occult blood test every 2 years. Option D, barium enema every year. So the right answer is option B, colonoscopy every 10 years. Anemia and fatigue in an elderly patient can be indicative of gastrointestinal bleeding, possibly from colorectal cancer. The most appropriate protocol for screening for colon cancer is a colonoscopy every 10 years. चलिए नेक्स्ट क्वेश्चन पर आगे बढ़ते हैं. A female patient with a unknown case of thyroid malignancy was found to show high levels of serum calcitonin. What is the most likely diagnosis? ये तो आप क्वेश्चन समझ गए होंगे. A female patient with a known case of thyroid malignancy was found to show high level of serum calcitonin. What is the most likely diagnosis? Option A, medullary thyroid carcinoma. Option B, systemic amyloidosis. Option C, thyroid lymphoma. Option D, papillary thyroid carcinoma. क्या लगता है आंसर आपको? So the right answer is option A, medullary thyroid carcinoma. Basically, the scenario is in this, the calcitonin is increased. So the right answer is medullary thyroid carcinoma. Next question. A 6-year-old child presented with a midline neck swelling that moves with deglutition and tongue protrusion. CT confirms the diagnosis of a thyroglossal cyst. Which of the following procedure is used in the management of this patient? Option A, modified radical neck dissection. Option B, radical neck dissection. Option C, cyst trunk operation. Option D, total thyroidectomy. So क्या लगता है आपका आंसर? A 6-year-old child presented with a midline neck swelling that moved with deglutition and tongue protrusion. CT confirms the diagnosis of a thyroglossal cyst. Which of the following procedure is used in the management of this patient? Option A, modified radical neck dissection. Option B, radical neck dissection. Option C, cyst trunk operation. Option D, total thyroidectomy. So the right answer is option C, cyst trunk operation. Basically, the treatment of choice of thyroglossal cyst is cyst trunk operation. चलिए नेक्स्ट क्वेश्चन पर आगे बढ़ते हैं. A male patient complains of a male patient complains of loss of appetite and dysphagia. He lost around 6 kgs of weight in the last 3 months. He was diagnosed with esophageal cancer a few years back and was treated for it. Which of the following could be the reason of his current presentation? Option A, esophageal cancer recurrence. Option B, fibrosis. Option C, eclasia cardia. Option D, GERD. क्या लगता है आंसर आपको? So the right answer is option A, esophageal cancer recurrence. So देखते हैं क्या इसमें explanation है. This patient with a significant weight loss of 6 kg in just 3 months and other symptoms along with a history of esophageal carcinoma suggest a recurrence. चलिए नेक्स्ट क्वेश्चन पर आगे बढ़ते हैं फटाफट. A man was brought after he fell into a manhole and injured his perineum. He was unable to pass urine and blood was seen at the tip of the urethra. A diagnosis of vulvar urethral injury was made. What do you expect the urine to get collected in this case? Option A, deep perineal pouch. Option B, medial portion of thigh. Option C, anterior abdominal wall. Option D, ischiorectal area. क्वेश्चन एक बार दोबारा सुनिए. A man was brought after he fell into a manhole and injured his perineum. He was unable to pass urine and blood was seen at the tip of the urethra. A diagnosis of vulvar urethral injury was made. What do you expect the urine to get collected in this case? Option A, deep perineal pouch. Option B, medial portion of thigh. Option C, anterior abdominal wall. Option D, ischiorectal area. So the right answer is option C, anterior abdominal wall. थोड़ा explanation देखते हैं. In vulvar urethral injury, the anterior abdominal wall is the one of the side for the collection of urine. चलिए नेक्स्ट क्वेश्चन में बढ़ते हैं आगे फटाफट. A patient presents with fever and flank pain. History revealed that he underwent kidney stone removal 4 years back. Imaging was done and a foreign body was detected. What is the appropriate course of action? Option A, cystoscopy and removal of the foreign body. Option B, laparotomy and cystoscopic removal. Option C, retrourethral approach. Option D, leave the foreign body inside. क्वेश्चन एक बार दोबारा सुनिए. A patient presents with fever and flank pain. History revealed that he underwent kidney stone removal 4 years back. Imaging was done and a foreign body was detected. What is the appropriate course of action? Option A, cystoscopy and removal of this foreign body. Option B, laparotomy and cystoscopic removal. Option C, retrourethral approach. Option D, leave the foreign body inside. So the right answer is option A, cystoscopy and removal of the foreign body. थोड़ा explanation देखते हैं. In a patient who has previously undergone kidney stone removal and now presents with fever, flank pain, and a foreign body detecting on imaging, the most appropriate course of action to perform a cystoscopy and remove the foreign body. चलिए नेक्स्ट क्वेश्चन पर आगे बढ़ते हैं. A patient with a direct hernia is posted for Lichtenstein repair. Which of the following is used in the mass? Option A, polyglycolic acid. Option B, polyproline. Option C, polyacrylamide. Option D, polygalactin. So the right answer is option B, polypropylene. For explanation देखते हैं. A Lichtenstein mass repair is currently one of the most frequent used method for treating an inguinal hernia. In this technique, a cone-shaped plug of polypropylene mass is used. चलिए नेक्स्ट क्वेश्चन पर आगे बढ़ते हैं. A male patient comes to the outpatient clinic with dilated tortuous veins in his lower limb. Varicose veins is suspected. Which of the following is the investigation of choice for this condition? Option A, duplex scan. Option B, plethysmography. Option C, MRI. Option D, CT scan. क्वेश्चन दोबारा सुनिए. A male patient comes to the outpatient clinic with dilated tortuous vein in his lower limb. Varicose vein is suspected. Which of the following is the investigation of choice for this condition? Option A, duplex imaging. Option B, plethysmography. Option C, MRI. Option D, CT scan. So the right answer is option A, duplex scan. Basically, the duplex ultrasound is the investigation of choice for varicose vein. चलिए नेक्स्ट क्वेश्चन पर आगे बढ़ते हैं. मैनेजमेंट ऑफ एन अपेंडिकुलर मास इन अपेंडिसाइटिस इज. मैनेजमेंट ऑफ एन अपेंडिकुलर mass in appendicitis is. Option A, laparoscopic appendectomy. Option B, Oshner's regime. Option C, incision and drainage. ऑप्शन डी, एल्वार्डो regime. दोबारा क्वेश्चन सुनिए. मैनेजमेंट ऑफ एन अपेंडिकुलर मास इन appendicitis is. Option A, laparoscopic appendectomy. Option B, Oshner's regime. Option C, incision and drainage. Option D, Alvarado regime. So the right answer is option B, Oshner's regime. Oshner's regime is indicated for patients with appendicular mass in whom conditions are stable. चलिए नेक्स्ट क्वेश्चन पर आगे बढ़ते हैं. A patient is brought into the casualty with maxillofacial trauma after an road traffic accident. He is unconscious with a dropping SpO2. The emergency room doctor decided to intubate him. What is the preferred method to intubate for this patient? Option A, mask ventilation. Option B, laryngeal mask airway. Option C, tracheostomy. Option D, nasotracheal intubation. Question सुनिए दोबारा. A patient is brought into the casualty with maxillofacial facial trauma. After an road traffic accident, he is unconscious with a dropping SpO2. The emergency room doctors decided to intubate him. What is the preferred method to intubate for this patient? Option A, mask ventilation. Option B, laryngeal mask airways. Option C, tracheostomy. Option D, nasotracheal intubation. So the right answer is option C, tracheostomy. थोड़ा explanation देखते हैं. Patients with severe maxillofacial trauma are very likely to experience severe airway compromise or obstruction. Hence, to maintain airway competency, intubate it necessary and in the above case. The presence of facial trauma, tracheostomy is the ideal choice. चलिए नेक्स्ट क्वेश्चन पर आगे बढ़ते हैं. A patient was rushed to the emergency department after being hit in the head in a road traffic accident. The patient was unconscious. CT scan revealed an extradural hematoma. Which of the following is the most likely injured? Option A, angle of mandible. Option B, lamboid suture. Option C, pterion. Option D, suprameatal triangle. क्या लगता है आपको? So the right answer is option C, pterion. For explanation, the pterion is the most likely injured. The bone in this area is thin, and any injury to this area may lead to rupture of the middle meningeal artery, leading to extradural hematoma. Pterion is an X-shaped sutural junction between four bones of the skull. चलिए नेक्स्ट क्वेश्चन पर आगे बढ़ते हैं. An intern is observing the procedure of thoracentesis. What is the site of needle insertion in this procedure? An intern is observing the procedure of thoracentesis. What is the site of needle insertion in the procedure, in this procedure? So option A, lower border of upper rib. Option B, upper border of lower rib. Option C, lower border of lower rib. Upper border of upper rib. क्या लगता है आपको आंसर? So the right answer is option B, upper border of lower rib. Because it is the correct site to insertion in the thoracentesis. Upper border, lower rib. Next question. Which of the following should be used for pre-operative management in a patient with pheochromocytoma? Pheochromocytoma. Option A, calcium channel blocker. Option B, beta blockers. Option C, alpha adrenergic blockers. Option D, nitroprusside. दोबारा क्वेश्चन सुनिए. Which of the following should be used for pre-operative management in a patient with pheochromocytoma? Option A, calcium channel blockers. Option B, beta blockers. Option C, alpha adrenergic blockers. Option D, nitroprusside. So क्या लगता है आपको आंसर? So right answer is option C, alpha adrenergic blockers. Alpha blocker like Fmge are given preoperatively to manage hypertension in Pheochromocytoma. Next question. A 4-year-old child is brought to the emergency with a painless mass in his abdomen. Examination revealed a large mobile abdomen mass that does not cross the midline. What is the most likely diagnosis? A 4-year-old child is brought to the emergency with a painless mass in his abdomen. Examination revealed a large mobile abdomen mass that does not cross the midline. What is the most likely diagnosis? Option A, neuroblastoma. Option B, angiomyolipoma. Option C, renal cell carcinoma. Option D, Bill's tumor. So the right answer is option D, Bill's tumor. The history of a large abdominal mass is a young child with pain is strongly without pain is strongly suggestive of Bill's tumor. चलिए नेक्स्ट क्वेश्चन में बढ़ते हैं आगे. क्योंकि जो बिल्स ट्यूमर होता है वो ज़्यादा से ज़्यादा 2 to 5 ईयर्स की एज में होता है. बिल्स ट्यूमर मोस्ट कॉमनली देखा जाए तो, और इस क्वेश्चन में एज भी 4 ईयर दी हुई है, तो बिल्स ट्यूमर. नेक्स्ट क्वेश्चन पर आगे बढ़ते हैं. चलिए. अ मैन केम विथ कंप्लेन ऑफ रिकरेंट डिस्चार्ज एंड पेन ड्यू टू लीजन्स around the anus for 3 years. A diagnosis of fistula in ano is made. What is the gold standard investigation for this condition? Option A, fistulogram. Option B, USG. Option C, CECT. Option D, MRI. दोबारा क्वेश्चन सुनिए. अ मैन केम विथ कंप्लेंट्स ऑफ recurrent discharge and pain due to lesion around the anus for 3 years. A diagnosis of fistula in ano is made. What is the gold standard investigation for this condition? Option A, fistulogram. Option B, USG. Option C, CECT. Option D, MRI. So the right answer is option D, MRI. Because the MRI is the gold standard investigation in fistula in ano. चलिए नेक्स्ट क्वेश्चन पर आगे बढ़ते हैं. A diabetic patient developed DVT with a necrolytic migratory rash. What is the most likely diagnosis? Option A, insulinoma. Option B, gastrinoma. Option C, glucagonoma. Option D, vipoma. क्वेश्चन सुनिए दोबारा. A diabetic patient developed DVT with a necrolytic migratory rash. What is the most likely diagnosis? Option A, insulinoma. Option B, gastrinoma. Option C, glucagonoma. Option D, vipoma. क्या लगता है आंसर? So the right answer is option C, glucagonoma. थोड़ा एक्सप्लेनेशन देखते हैं. नेक्रोलाइटिक माइग्रेटरी एरिथमा स्किन लीजन along with a history of long-standing diabetes and recurrent deep vein thrombosis is suggestive of glucagonoma. चलिए नेक्स्ट क्वेश्चन पर आगे बढ़ते हैं फटाफट. A 44-year-old lady presents to the hospital with a flank mass that is valuable on CT imaging. The mass measures 4 cm. Urine examination shows malignant cells. What is the most appropriate management for her condition? Option A, partial nephrectomy. Option B, partial nephrectomy plus neoadjuvant chemotherapy. Option C, radical nephrectomy. Option D, radical nephrectomy plus post-operative radiotherapy. क्वेश्चन दोबारा सुनिए. A 44-year-old lady presents to the hospital with a flank mass that is velatable. On CT imaging, the mass measures 4 cm. Urine examination shows malignant cells. What is the most appropriate management for her condition? Option A, partial nephrectomy. Option B, partial nephrectomy plus neoadjuvant chemotherapy. Option C, radical nephrectomy. Option D, radical nephrectomy plus post-operative radiotherapy. So the right answer is option A, partial nephrectomy. Partial nephrectomy is performed of renal cell carcinoma tumors less than 4 cm size. चलिए नेक्स्ट क्वेश्चन पर आगे बढ़ते हैं फटाफट. A 32-year-old female undergoes emergency laparotomy for perforation peritonitis. Which of the following is the surest sign of wound dehiscence? Option A, copious serosanguinous discharge. Option B, rebound tenderness. Option C, hemorrhage. Option D, hypotension. क्वेश्चन दोबारा सुनिए तो. A 32-year-old female undergoes emergency laparotomy for perforation peritonitis. Which of the following is the surest sign of wound dehiscence? Option A, copious serosanguinous discharge. Option B, rebound tenderness. Option C, hemorrhage. Option D, hypotension. So the right answer is option A. The surest sign of wound dehiscence is copious serosanguinous discharge. चलिए नेक्स्ट क्वेश्चन पर आगे बढ़ते हैं. Which of the following will not have bilateral hydronephrosis? Which of the following will not have bilateral hydronephrosis? Option A, phimosis. Option B, posterior urethral valve. Option C, urethral strictures. Option D, retrocaval ureter. Which of the following will not have bilateral hydronephrosis? Option A, phimosis. Option B, posterior urethral valve. Option C, urethral stricture. Option D, retrocaval ureter. So the right answer is option D, retrocaval ureter. चलिए नेक्स्ट क्वेश्चन पर चलते हैं आगे. 4 patients were brought to the casualty after sustaining trauma. Which of the following is the correct match of injuries and signs among the following? Option A, extradural hemorrhage, pinpoint pupil. Option B, penetrating injury to ischemic tube, CSF otorrhea. Option C, penetrating injury to eye, Battle sign. Option D, gaze paresis, mid-brain lesion. क्या लगता है आपको आंसर? So the right answer is option D. Gaze paresis, mid-brain lesion is the right match the following. Gaze paresis, mid-brain lesion is the correct matched pair among the given option? चलिए नेक्स्ट क्वेश्चन पर आगे बढ़ते हैं. A homosexual man complains of painful defecation and mass protruding from the anal canal. Biopsy reveals squamous cell carcinoma of anus. Correct management for this patient is option A, chemotherapy, option B, abdominoperineal repair, option C, combined chemoradiation, option D, wide local excision. चलिए दोबारा सुनिए एक बार. A homosexual man complains of painful defecation and mass protruding from the anal canal. Biopsy reveals squamous cell carcinoma of anus. Correct management of this patient is option A, chemotherapy, option B, abdominoperineal repair, option C, combined chemoradiation, option D, wide local excision. So the right answer is option C, combined chemoradiation. Basically, the management of choice for squamous cell carcinoma of the anal canal is combined chemotherapy and radiation therapy, also called nigro regime. चलिए थोड़ा चलिए नेक्स्ट क्वेश्चन पर चलते हैं. A 25-year-old patient presents to the surgical OPD with a painless left inguinal reducible mass. On examination, cuff impulse is positive. After further investigations, the patient is diagnosed with an inguinal hernia. What is the surgical management of this patient? Option A, herniotomy. Option B, hernioplasty. Option C, wait and watch. Option D, emergency laparotomy. दोबारा सुनिए पर क्वेश्चन. A 25-year-old patient present to the surgical OPD with a painless left inguinal reducible mass. On examination, cuff impulse is positive. After further investigation, the patient is diagnosed with an inguinal hernia. What is the surgical management of this patient? Option A, herniotomy. Option B, hernioplasty. Option C, wait and watch. Option D, emergency laparotomy. So the right answer is option B, hernioplasty. चलिए नेक्स्ट क्वेश्चन पे चलते हैं आगे. While doing an endoscopy, constriction is felt at the esophageal junction at 25 cm from the incisor. This is due to option A, inferior vena cava, option B, arch of aorta, option C, right bronchus, option D, diaphragmatic opening. Question सुनिए दोबारा. While doing an endoscopy, constriction is felt at the esophageal junction at 25 cm from the incisor. This is due to option A, inferior vena cava, option B, arch of aorta, option C, right bronchus, option D, diaphragmatic opening. So the right answer is arch of aorta. The arch of aorta and left bronchus crosses the esophagus at 25 cm from the upper incisor teeth. चलिए नेक्स्ट क्वेश्चन पर चलते हैं आगे. All of the following are true about nephroblastoma except option A, treatment is chemotherapy followed by surgery. Option B, early lung metastasis. Option C, hematogenous spread. Option D, most common intra-abdominal malignancy in children. All of the following are true about nephroblastoma except मतलब सब सही है लेकिन कौन सा गलत है वो बताना है आपको. तो ऑप्शन ए, ट्रीटमेंट इज कीमोथेरेपी फॉलोड बाय सर्जरी. ऑप्शन बी, अर्ली लंग मेटास्टेसिस. ऑप्शन सी, हेमेटोजीनस स्प्रेड्स. Option D, most common intra-abdominal malignancy in children. So the right answer is option D, most common intra-abdominal malignancy in children. Basically, neuroblastoma is the most common intra-abdominal malignancy in children, not nephroblastoma. In neuroblastoma, you can see all these malignancy, most common intra-abdominal malignancy in children, not in nephroblastoma. चलिए नेक्स्ट क्वेश्चन में आगे बढ़ते हैं. Which of the following is not a component of qSOFA score? ये तो पता होगी आपको, फिर भी रिवाइज करना जरूरी क्योंकि इंपॉर्टेंट टॉपिक है ये. ऑप्शन ए, रेस्पिरेटरी रेट मोर देन और इक्वल्स 22. ऑप्शन बी, LDH lactate dehydrogenase basically. Option C, altered mental status. Option D, systolic blood pressure less than or equals to 100 mmHg. क्या लगता है आपको आंसर इसका? फटाफट. So the right answer is option B, LDH lactate dehydrogenase is the right answer because it is not a qSOFA, include in a qSOFA score. Basically, the qSOFA score component is respiratory rate more than or equals to 22, altered mental status, or systolic blood pressure less than or equals to 100 mmHg. चलिए नेक्स्ट क्वेश्चन पे बढ़ते हैं आगे फटाफट. Which is least commonly used graft for coronary artery bypass graft? Which is the least commonly used graft for coronary artery bypass graft? Option A, long saphenous vein. Option B, internal mammary artery. Option C, intercostal artery. Option D, radial artery. Answer. So the right answer is option C, intercostal artery. Basically, the intercostal artery is the least likely to be used as a graft in CABG. चलिए नेक्स्ट क्वेश्चन पर चलते हैं आगे. A 32-year-old patient who is a chronic tobacco chewer presents with a whitish lesion on the gingivobuccal sulcus for 7 months. What is the next best steps in the management of this condition? Option A, local excision and biopsy level. Option A, local excision and biopsy. Option B, avoid smoking, wait and watch. Option C, steroidal injection. Option D, sclerotherapy. क्या लगता है आंसर? क्वेश्चन सुनिए दोबारा एक बार. A 32-year-old patient who is a chronic tobacco chewer presents with a whitish lesion on the gingivobuccal sulcus for 7 months. What is the next best step in the management of this condition? Option A, local excision and biopsy. Option B, avoid smoking, wait and watch. Option C, steroidal injection. Option D, sclerotherapy. So the right answer is option A, local excision and biopsy. Basically, the diagnosis scenario is a leukoplakia, or the best step management is local excision and biopsy in leukoplakia. चलिए नेक्स्ट क्वेश्चन पर आगे बढ़ते हैं. A 60-year-old patient presents with painless hematuria. He is diagnosed with bladder cancer involving the muscle layer. What is the next best step in the treatment of this patient? Option A, intravesical administration of BCG. Option B, radiotherapy. Option C, neoadjuvant chemotherapy with mitomycin C. Option D, radical cystectomy. क्वेश्चन एक बार दोबारा सुनिए. A 60-year-old patient presents with painless hematuria. Painless hematuria. He is diagnosed with bladder cancer involving the muscle layer. What is the next best step in the treatment of this patient? Option A, intravesical administration of BCG. Option B, radiotherapy. Option C, neoadjuvant chemotherapy with mitomycin C. Option D, radical cystectomy. So the right answer is option D, radical cystectomy. Explanation. The radical cystectomy is the preferred mode of management for a patient with bladder cancer involving the muscle layers. Basically, the smoking and exposure to chemicals are strongly associated with the development of bladder cancer. चलिए नेक्स्ट क्वेश्चन पर आगे बढ़ते हैं. A chronic alcoholic presents to the emergency room with acute pain, abdomen in the epigastric region, radiating to the back with nausea, anorexia, and occasional vomiting. Investigations showed elevated amylase level and total count. Likely diagnosis is option A, acute hepatitis. Option B, acute pancreatitis. Option C, acute cholecystitis. Option D, acute appendicitis. दोबारा सुनिए क्वेश्चन. A chronic alcoholic presents to the emergency room with acute pain, abdomen in the epigastric region, radiating to the back with nausea, anorexia, and occasional vomiting. Investigation shows elevated amylase level and total count. Likely diagnosis is option A, acute hepatitis. Option B, acute pancreatitis. Option C, acute cholecystitis. Option D is acute appendicitis. So the right answer is option B, acute pancreatitis. Basically, the epigastric pain radiating to the back or chronic alcoholic patient with elevated serum amylase level are most consistent basically to diagnose the pancreatitis, acute pancreatitis. चलिए नेक्स्ट क्वेश्चन पर आगे बढ़ते हैं. A 50-year-old woman after thyroidectomy comes to you for second opinion for further treatment of papillary thyroid cancer. What would you recommend for this patient? Option A, radiotherapy. Option B, chemotherapy. Option C, radio iodine scan. Option D, wait and watch. क्या लगता है आपको? A 50-year-old woman after thyroidectomy comes to you for second opinion for further treatment of papillary thyroid cancer. What would you recommend of this patient? Option A, radiotherapy. Option B, chemotherapy. Option C, radio iodine scan. Option D, wait and watch. So the right answer is option C, radio iodine scan. Basically, the radio iodine scan will use recommended for the thyroidectomy patient to look for the residual or metastatic diseases. चलिए नेक्स्ट क्वेश्चन पर आगे बढ़ते हैं. A patient who was diagnosed with prostate cancer is being investigated. The bone scan is reported as a super scan with increased uptake in the bones and reduced activity in the spleen. What is the reason for this super scan appearance? Option A, increased uptake due to diffuse metastasis. Option B, increased uptake by carcinoma prostate. Option C, increased uptake by the bone. Option D, decreased uptake by adrenal glands and kidney. So the right answer is option A, increased uptake due to diffuse metastasis. चलिए नेक्स्ट क्वेश्चन पर आगे बढ़ते हैं. Which of the following is the best imaging modality to diagnose neuroendocrine tumors? Option A, USG. Option B, CT. Option C, MRI. Option D, PET. So the right answer is option D. Positron emission tomography is PET is the best modality to diagnose neuroendocrine tumors. Next question. Genetic testing for BRCA1 or BRCA2 is indicated for all of the following except option A, breast cancer diagnosed in a post-menopausal female more than 50 years of age. Option B, male breast cancer. Option C, bilateral breast cancer. Option D, breast and ovarian cancer. क्या लगता है क्या होगा इसका राइट आंसर? So right answer is option A, breast cancer diagnosed in a post-menopausal female more than 50 year of age. इसमें हम जेनेटिक टेस्टिंग नहीं करते हैं BRCA1 BRCA2 की. बाकी सब जो ऑप्शन है उसमें करते हैं। Genetic testing is not recommended in post-menopausal female more than 50 years of age. चलिए नेक्स्ट क्वेश्चन पर आगे बढ़ते हैं। Which lymph node is most commonly involved prostate cancer? Which lymph node is most commonly involved in prostate cancer? Option A, deep inguinal. Option B, pelvic. Option C, superficial inguinal. Option D, internal iliac. So the right answer is pelvic. The most common lymph node of metastasis disease in prostate cancer is the pelvic lymph node. चलिए आज के दिन का लास्ट क्वेश्चन। What is the ideal time and method of removing hair before surgery to avoid surgical site infection? Option A, on the OT table with electric hair clippers. Option B, with a razor 24 hours before surgery. Option C, with a hair removal cream on the previous day. Option D, on the OT table with a razor. So the right answer is option A, on the OT table with electric hair clipper. थैंक यू फॉर वॉचिंग दिस वीडियो। अगर आपको वीडियो पसंद आई तो प्लीज लाइक शेयर करें ज़्यादा से ज़्यादा लोगों के साथ, और अगर आपको ऐसी और वीडियो देखनी है तो प्लीज सब्सक्राइब करें चैनल को। थैंक यू।